anytime an athlete takes an extended time away from training and play, like recovering from an injury, it's important to take certain steps to safely return. Athletes of all ages have been facing a very unique situation with spring sports seasons that were cut short due to social distancing measures to prevent the spread of COVID-19. But as practices and sports leagues are beginning to reopen and athletes are getting ready to go back into the game, Dr. Troy Smurawa, the director of sports medicine at Children's Health and Andrews Institute in Plano, joins us today to share how they can do that safely. Doctor, how you doing?
I'm doing fine, thank you. How are you?
Good. Thank you so much for joining us today. Now, like we said, obviously, world has been a little bit different, especially when it comes to athletes right now. What can you tell us what happens to the body, athlete or non-athlete, when it experiences a prolonged decrease in physical activity?
Yes, when an athlete or anybody sits out of sports for a long period of time or any type of physical training, their body does decondition. And that affects kind of we call it the muscular system. So they lose muscular endurance and strength. They also reduce their cardiorespiratory or their endurance, their kind of the ability to maintain activity for a long period of time. I think also the third component we don't think about is that a lot of these athletes are in skilled sports, so they actually lose their skills for that specific sport.
And then obviously something like prolonged taking off for a amount of time can not only affect a person physically. Have you noticed social distancing restrictions having any sort of mental effects on athletes?
Yes, that's a big consideration that we see, especially in high school young athletes, where they're not only restricted from socializing with their fellow athletes, but also they're not socializing with their fellow classmates in school. So they're having two aspects where they're withdrawn from their normal social uh, peers and environment. So oftentimes this can lead to signs of fatigue, mental fatigue, lack of motivation, even symptoms of early or mild depression.
Now, for anyone getting ready to resume practices, we know that Texas high school football and high school athletes have been back a little bit this week.
Mhm.
But even just for someone going outside to run or exercise a little bit more, what are some physical and mental obstacles that they may face after experiencing so much downtime?
Well, I think the biggest thing we mentioned before is their body is deconditioned. So a lot of these kids and athletes were training and participating in a sport and abruptly it ended. So they didn't have that traditional decrease at the end of the season, the anticipation that there's going to be an off season. So right now there's a lot of anxiety and anticipation of getting back in their sport at the level they were before. So there's a tendency to jump right back in where they left off at the same intensity level, the same amount of time they're practicing. So that can lead to early fatigue and overuse injuries and burnout. So I think the biggest thing is to realize this is a progressive process, not to skip any steps, but take things gradually. So that work on both the muscular endurance, so making sure they're regaining their strength by going into the weight room or doing the strength and conditioning that they do. Also to know that they need to really improve their cardiorespiratory endurance. And their body has been sitting around for a while. Now they need to get out and train and do more activities. I think also the thing to realize is that we stopped sports in mid-March and we were in early spring and the weather outside was rather cool. Now we're in June, the middle of summer, and the temperature is a little bit hotter. So a lot of these kids haven't had the normal time to acclimate to the warm environment. So they also need to know that they are training outside and they have to really acclimate to the warm environment, making sure we do the things we do every summer, stay hydrated, make sure your body is covered with sunscreen so you don't get exposed to the sun and get heat stroke. Also that you stay hydrated and drink and practice in the shade and limit the amount of times you practice outside.
Absolutely. And how long should, looking at the other side of it, how long should coaches expect it to take for their athletes to get back to that previous level of performance that they were at in mid-March?
That's a good question. Most people in a normal year would have, about a 4 to 6 week of preseason where they would acclimate, get into their conditionings, getting cardiorespiratory endurance, strengthening, and then when they enter the season, they're at that level of shape that they want to be in. So I think that's a good range is anticipate about 4 weeks, maybe up to 6 weeks, depending upon the demands that their sport requires, and not to rush that because a lot of these kids, if they rush through it, they're going to get tired, they're going to get fatigued, they're not going to perform as well, and they may drop out or actually develop overuse injuries.
And then pertaining to COVID-19 in particular, what safety advice or recommendations can you provide parents, coaches, and the athletes to remain as safe as possible through this transitional period of getting back into things?
Yes, I think that's a very good question, because not only are we getting these kids back into playing sports from being out for a long period of time, but we have to take that in context of making sure they return safely with the concerns about COVID-19, the background. So some of the things that we've recommended, and as well as most of the high school athletic federations recommended, is to take it in phases and making sure they're addressing the appropriate things that they need to do to minimize or reduce the spread of an infection within their athletes and their athletic population. So I think the first thing that we recommend doing is making sure that they're screening athletes and coaches for any signs or symptoms that they might have that they may be infected. So every session, every workout should ask questions if they have a cough, a fever, been around anybody else been sick, even taking a temperature. I think the second part of it is maintaining that sanitation, which includes making sure they're cleaning all their equipment. So not sharing balls or equipment, making sure they're wiping it down in between people so that they're not minimizing the risk of spreading in case someone does bring it into the area. The other thing is talk about wearing masks. Now, obviously, it's very difficult for some of these athletes to wear masks while they're participating in high intensity activities. We do know that if we're outside, that there's more space to spread. So keeping them spread out and outside and wearing the mask off is okay. When they come inside for more indoor sessions or workout sessions where lifting weights, that's where they need to really focus on distancing, making sure they're wearing a mask, and really being careful to clean the equipment in between them athletes. One of the things that we do also talk about is what do you do in case someone gets an infection? How do you prevent it, or what do you do with a team? So one of the suggestions is to have athletes train in pods throughout the summer. So a group of 6 to 10 athletes always work out together, and they're really isolated from the other athletes as best they can. So if one person is ill or gets sick or gets infected, then it only affects that pod of people, and they can remove those from the whole team so it doesn't affect the whole team with it. And I think the other important thing is making sure that the athletes are very in tune and educated about minimizing the risk of them getting infected or spreading infection. So that things like hand washing before they get there, after they get there, always wearing clean clothing to every workout, when they get home after a workout to change their clothing and shower. Also to make sure they minimize touching their faces, things like that that can spread the infection to them or to other people.
Absolutely. And doctor, before I let you go here, we talked a little bit before we got on the call that you're from Wisconsin. You played football up there. You're down in Plano
Yes.
now. I'm sure you get plenty of Texas high school football to take in and watch. How different is that?
Well, it is a lot different. I mean, they do like football in Wisconsin and the upper Midwest, but there are a lot of other sports that people participate in. But football down here in Texas is pretty popular. A lot of kids are playing in sports. It's pretty high demand, so there's a lot of pressure on the kids to participate. But it's really nice to be in an environment where people really take hold of football in Texas and appreciate their kids and really support the kids and what they do. And I really enjoy being here in Texas and taking care of Texas high school football students.
Well, Doc, thanks. I knew I had to ask you about that, but we appreciate all that Andrews Institute and Children's Health does for the student
Yes.
athletes. And we thank you very much for joining us here today, and hope y'all are staying safe out there.
Thank you, and have a great, safe day.